I've been asked to provide you with some guidance on how you can use data to inform your strategy. And for those of you that are trying to create a strategy for your workforce and covered lives, you need a strategy that keeps your people well, reduces the health risks for the people who have health risks, makes sure that people have access to care, largely with establishing a medical home so that when they have an acute illness, it doesn't fester and become chronic. Help people who already have a chronic disease so that they don't succumb to the complications of their chronic disease, and make sure that people who have a significant medical challenge get the best care possible. So, when you are looking at data in relationship to the population health continuum, the more things that you can put together in a data warehouse, the more informed your strategy can be. But it can certainly start just by looking at the individual reports that you get from your separate vendor partners, especially looking at the summary over a few years from your PBM and from your health plan providers. Remember, of course, that while the focus often is on healthcare costs, the data is very clear. Dear CEO, for every dollar that you spend on healthcare, you're losing $2 to $3 of performance and productivity. And so all of us, as we think about things, have to have a data warehouse ultimately that allows us to show inside your own company the power of a healthy workforce. Well, I want to talk a little bit now about some strategies as it relates to data. One of the things that we recommend strongly is this idea of grouping versus splitting. So if your health plan, TPA, or carrier gives you a report that says you have 7% of your people have depression, and 9% of your people have anxiety, and 11% of your people have attention deficit disorder, and 4% of your people have some type of substance abuse issue, and 3% of your people have an alcohol problem. That is not helpful. It's not helpful. What you want is to add all of that together so you can get the attention of the C-suite. Everybody in this room complains about how they don't get the resources they need from the C-suite. And that's because we haven't presented the data the way it has to be presented. Not too long ago, I went to one of my clients and I said, look, the data shows that 1 out of every 4 of your people have a mental health issue. And the CEO and the chairman of the board said, Dr. Ray, are you telling me that 1 out of every 4 of my people have a mental health issue? And after I showed him the data by adding up the depression, the anxiety, the attention deficit disorder, and everything else, it was 1 out of every 4. So grouping instead of splitting becomes very important for, among other reasons, so that you can get the resources that you need to help your people in remarkable ways. It's also important for all your vendors to report to you with a waterfall. So let's just say, for example, that your company had a 1,440, this is a real case, 1,440 diabetics. And you hired a point solution to help with diabetes disease management. And of the 1,440, there was a drop-off because not all of the phone numbers or the emails, addresses were accurate, and so only 1,300 and some were invited to the program. And then only 1,200 enrolled, and then only 1,000 actively participated, and only 600 or 700 completed the program. And then, at the end of this entire trail, there were only 400 or so that had a positive impact. Now, if you know all these different steps along this continuum, it can markedly inform your strategy. Because if there's a significant drop-off between eligibility and the ability to invite people to participate, that's actually your problem at the company or enterprise level. It's not the point solutions problem. And if there's a huge drop-off in enrollment, that's also your problem, mostly, because you have to have a robust marketing and communications campaign to get every single diabetic into the program. Now, on the flip side, if a bunch of people enroll but only a few people finish, that's the point solutions problem. I want to introduce you to a concept that I've been cultivating over the last decade, which I call the illness burden placemat. And this is something that you should work very hard to try to achieve. On one single page, you should be able to show what are the prevalent risk factors in your population, what are the reasons why people access health care with grouping, and then what's the major reasons why people are on a medicine, and what are the most prevalent chronic conditions, and what are the most prevalent diagnoses that lead to high-cost claimants, and why are people going on disability, and then lastly, why are the people in your organization dying? Now, when you're looking at metrics to determine what a good metric is, there are clear elements that you want to make sure that you have when you are developing what I like to call your cockpit, or your dashboard, or your scorecard. And you want them to be, if you can, quantitative, for example, rather than qualitative. You want an actual numeric value. You want leading versus lagging indicators. And you want things that connect causally if it's possible. But when you measure things in your company, you don't want it to create fear. The idea here is not to use metrics for surveillance purposes, but to engender trust and to show everybody in the organization how much you care about them individually and collectively. And so here's the message. The message for our session this morning is really all about data which can be analyzed to provide you with knowledge so that you can take strategic action. And whenever you're developing your metrics, you want metrics that follow along the triple aim. You want metrics that get somebody like me, who's a chief medical officer, excited because there's evidence that you're actually making your population healthier. You want metrics that excite the CFO of your company because you're either saving money or making the company more productive. And you want metrics that excite the chief human resource officer because you're able to demonstrate that the people that you touch, the people inside your enterprise, appreciate what you're doing. When I teach the triple aim, I'm always thinking about effectiveness, efficiency, and experience. This is how you can then interpret the results for the C-suite by turning things into a report with lay language. I want you to leave here with at least that gift, that you're not doing a comprehensive effort unless you're keeping your well people well, reducing health risks, making sure that everybody has a medical home, at least paying attention to your prevalent chronic conditions, and exercising things like centers of excellence for everybody in your organization who's challenged by a very significant medical problem. You want to try to do your very best to integrate data over time, but in the beginning you can accomplish a great deal just by looking at separate reports and trying to mesh them together on your own. You want to insist on waterfall reporting. You want to make sure with things like this illness burden placemat that we developed that you have a clear understanding of your prevalent risks and conditions so that it can steer your strategy to at least focus on them. And you want to gather and organize actionable metrics.